Now to the pandemic, there is good news and bad news about that Omicron surge. The new 7-day average for COVID deaths in the U.S. is approaching 2,200 a day. That's the highest in nearly a year. That's the bad news. But the CDC says fewer patients have been admitted to the hospital nationwide compared to previous waves. That's the good news. Hospitalizations are still climbing in some parts of the country where fewer people are vaccinated, including Oklahoma. Kris Van Cleave is at St. Anthony Hospital. That's in Oklahoma City. Kris, good morning to you.
Good morning. Oklahoma could lead the nation this week in hospitalizations because Omicron is yet to peak here. That could also happen this week, but there's a staffing shortage hitting hospitals here in Oklahoma City hard. They have 300 fewer available and staffed hospital beds than they did a year ago. And this hospital says they haven't had an open and available ICU bed in about 6 weeks. This morning, Oklahoma hospitals are at the brink. Every ICU bed in the state's capital city is full, with dozens of patients waiting for one to open.
I try to treat each patient like they're my family. So, then it happened to my dad, and it's different.
ER nurse Nicole Green will spend 12 hours today at a hospital slammed by COVID, as her 61-year-old father, Brett, battles for his life at another. He got sick last Tuesday, was in the hospital on Thursday, on a ventilator by Friday, but couldn't get an ICU bed until Saturday night.
It's hard, it's hard knowing and seeing what I've seen, and then knowing that there is a chance that my dad could die.
What would you tell Dad right now?
I would tell him to keep fighting, that we love him, and just keep fighting.
It's a fight playing out hourly in ICUs and hospitals across the Sooner State, prompting 4 of the largest hospital groups to warn residents in an open letter the Oklahoma City healthcare system is at a breaking point and pleading with people to get vaccinated and boosted. Statewide, less than 55% are fully vaccinated.
Right now, probably 80% of the people that we actually have in the hospital are unvaccinated.
St. Anthony Hospital Chief Medical Officer Dr. Kersey Winfrey was one of the letter's authors. How close are you to the worst-case scenario?
I think that on any given day, you feel like you're in it at the present moment.
The next step.
The hospitals are juggling too many patients while dealing with staffing shortages, limited supplies of therapeutics, and even a shortage of oxygen containers, which forced 71-year-old Johnny Carey into a much sought-after hospital bed.
If I had the oxygen, I could have stayed home. Never went. So a lot of the rooms that are full in the hospital is just because people can't get the oxygen.
Now, Brett Green's family tells us doctors are optimistic, but it could be several more days before they have a clear prognosis. And like so many people we talked to here in Oklahoma, they did not want to discuss vaccination status. It has become a polarizing issue that hospitals say is so important if they're going to get any kind of relief. Tony?
Kris Van Cleave from one of the new epicenters of this surge. Kris, thank you very much.